Everything that I was ever told about my chronic pain by my doctors turned out to be complete and total bullshit. It really was. Here's what happened. About 4 years ago, while I was running, I just instantly felt a sharp pain in my lower back, and it would not go away. Anytime I moved, it seemed to hurt even more, and I was pretty much in constant pain from that moment on. I had to give up running. I couldn't sit down for long. I couldn't work very well. Everything was difficult. It was devastating. Well, I eventually ended up, like most people, sitting in front of an orthopedic surgeon, and he pointed to my MRI and told me very clearly, in no uncertain terms, that it was defective discs that were causing my pain. And of course, I accepted this as fact, even though I later came to find out that all adults with or without pain have disc abnormalities just like mine. In fact, studies show that a correlation between herniated discs and pain is pretty much non-existent. But I didn't know that at the time, so for the next 2.5 years, I followed the medical protocol. I took the medication, I went to physical therapy, I went to the chiropractor, I went to pain management, I got the epidural shots. And you know, all this treatment was based on that surgeon's original diagnosis of a defective spine. Well, nothing worked, and of course nothing worked, because as I later came to find out, there was nothing wrong with my spine. So what was really going on is that stress, tension, anxiety, and anger that I had been repressing probably for years or even decades was now being expressed in the form of chronic pain. And I know that sounds hard to believe, but it's absolutely true. We all repress emotions, and those emotions have the potential to cause chronic pain in anyone, especially people with certain personality types. The accurate diagnosis for what was going on with me is Tension Myositis Syndrome, or TMS for short. Now, the pain I was experiencing was absolutely real. It just was not coming from my L4 and L5 discs, but rather the muscle tissue in my lower back. In fact, the word myositis means muscle inflammation. So what was really happening was that tension was causing muscle inflammation, and it was that muscle inflammation that was actually causing the pain. And it's not just me. This is a condition that affects millions of Americans in the form of neck, back, shoulder pain, fibromyalgia, tendinitis, sciatica, and what I believe is probably 90% of the chronic pain in America. No one's getting better because the medical community is stuck on the wrong diagnosis, and they only treat symptoms. Once I understood what was actually happening to me and got education and got coaching, my pain was gone in 30 days. And that was after 2.5 years of no improvement. It was amazing, and it still is amazing. I was able to get rid of my standing desk, my pain medication, all my special cushions, and I now run and exercise almost every day. I have no pain. So where did TMS come from? Well, it's the life's work of the great Dr. John Sarno, MD. Sarno recently retired after a 50-year career as professor of rehabilitation at New York University Medical Center. And while practicing, Sarno treated over 10,000 chronic pain patients, in effect curing them of their pain without using any medical treatment. As Sarno puts it, education is the cure. And that's really the point here, is that you don't have to manage your pain. You can cure it. I did, and thousands of other people have as well. Here at the Pain Cure Clinic, we've developed a 5-step process that, while based on Sarno, is more contemporary, more physical, more functional, and because of that, more effective for most people. So if you're tired of managing your pain and you're ready to call bullshit on the medical community like I did, and get your life back, we are here to help. Thanks for watching, and we'll look forward to helping you become pain-free.